Okay, good afternoon, everyone, and welcome to another webinar from the GIN North America Regional Community. I am Dina Baptiste, the current chair of the GIN North America Steering Committee and your moderator for today. I would like to also acknowledge Ms. Uzma Kazmi, who will be co-moderating this session with me today. Thank you for taking the time to join us and welcome. Our topic today is from pain points to progress, solving guidelines challenges using human-centered design. Today's webinar is the final installment of our human-centered design and digital guidelines series. We started in 2023. Next slide. This year marks the 15th anniversary of the Guidelines International Network, North America Regional Community. We're a community of guideline developers, adapters, implementers, as well as systematic reviewers and researchers from Canada, Mexico, and the United States. Please note that this webinar is being recorded and the recording will be available on the GIN YouTube channel within a few days. Also, if you are a GIN member and you are not signed up on GIN Connect, we encourage you to do so as soon as possible, as this is our main platform for communication. And if you are not a GIN member, we encourage you to visit the GIN homepage or drop us an email to learn more about the benefits of membership. Next slide. Also, early registration is now open for the Guidelines International Network Conference scheduled for September 16th through the 19th in Geneva. Early registration closes on June 17th, so please mark your calendars to take advantage of that. Our speaker, next slide. Our speakers for today have the following disclosures. We have no disclosures except for Mindy Hagels-Bin, who is the CEO of Viren Consultants, which provides consulting services on human-centered design. And she also received a travel cost reimbursements and small honorarium from GIN to facilitate the workshop described in this presentation, which was held in 2023. Next slide. Now, just a few housekeeping things. The webinar after the speakers present, we will have a question and answer session. We encourage you to drop your questions using the Q&A feature on the Zoom platform. We will also be utilizing the chat feature, as this presentation will also have some interactive components. So please listen carefully to our speakers as they would cue you as when to use that feature. Next slide. Now I would like to introduce our speakers for today in alphabetical order. We have Dr. Shireen Shahab, who is a public health informatics fellow serving as health scientist with the Data Standards and Policy Division at the Centers for Disease Control and Prevention. Dr. Shahab also advocates for the adoption of public health data standards, policy, and interoperability, fostering seamless integration and optimized functionality across the U.S. health systems. Before joining the CDC, Dr. Shahab was the Executive Director of Clinical Support Units and Supply Chain and Logistics Units at the American University of Beirut in Beirut, Lebanon. Her experience and leadership have been focused on strategic initiatives, crisis management, operation efficiency, and large-scale projects. Dr. Shahab holds the prestigious Alumni Award from the Delta Omega Honorary Society in Public Health. She is a certified professional for health care quality a certified Six Sigma Black Belt, and a candidate fellow for the American College of Healthcare Executives. Next, we will be hearing from Miss Mindy Hagelsben, who is the owner of Varin Consulting and a healthcare transformation leader with over 15 years of experience applying human-centered design, lean agile methods in government, healthcare, and IT. She has led national initiatives with CDC and CMS to redesign clinical guidelines and quality measures, ensuring they are more usable, equitable, and aligned with real-world workflow. With a background in engineering and deep expertise in health IT policy and value-based care, Minda brings a systems thinking approach to designing practical people-centered solution across complex healthcare environment. And no stranger to the Guideline International Network, especially the North America region. We will also hear from Maria Michaels, who is the leader of this effort. Maria is a special expert for digital health at the Agency for Healthcare Research and Quality, using technology to transform data into action in healthcare and public health. She's also the immediate past chair of the GIN North America Regional Steering Group, and she co-chairs the Learning Health Systems Working Group at Health Level 7. Prior to joining AHRQ, Maria was a senior public health advisor and health scientist in informatics at the Centers for Disease Control and Prevention, where she led multiple national and international initiatives, including adapting clinical guidelines for the digital age to redesign guideline development and implementation to co-develop computable and narrative clinical guidelines, and making electronic data more available for research and public health, to automate data exchange using standard-based approach. So today we will be hearing from these three speakers. Your line should be muted, but please do a quick check to make sure it is. And now I'll turn it over to our speakers for today.
Thank you, Dina. So we'll jump right into solving guideline challenges using human-centered design. And I'll just mention that even though there are three of us presenting today, we're doing so on behalf of the GIN North America community, in particular, those that participated in this effort. So we're going to start with building on previous global initiatives, jump into human-centered design, or HCD. We'll then tell you how GIN North America used HCD to solve guideline challenges, and we'll end with how to model GIN North America's HCD approach so that you could replicate it for your own groups or organizations. And if you want to read more about this, we also published in GIN's journal, Clinical and Public Health Guidelines. You can use the QR code to the bottom right if you'd like to take a look right now. And we also have a link in the citation in the top left. So building on previous global initiatives, we'll start with the tale of two initiatives. The first, which is adapting clinical guidelines for the digital age. In 2017, 2018, the U.S. Centers for Disease Control and Prevention, or CDC, began a multi-organizational, multidisciplinary initiative to find root causes of issues with guideline implementation and determine how to fix them. Participation began within the US, but quickly expanded internationally. And one of those international partners was the World Health Organization, or WHO, which in mid-2018 also began its own related initiative called Standards-Based, Machine-Readable, Adaptive, Requirements-Based, and Testable, or SMART Guidelines. The goal of SMART Guidelines was to develop a new approach to systematize and accelerate the consistent application of recommended life-saving interventions in the digital age. And of course, by nature of WHO, their participation was international from the beginning. Now, we talk about both of these initiatives here, and I think about them as conversely complementary. And what I mean by that is that in adapting clinical guidelines, The initiative really started with the entire process of guideline development and implementation, redesigned it, and then sought to apply it to individual guidelines. Whereas the SMART Guidelines initiative started with an individual guideline and developed tools to then apply to additional individual guidelines. And so since 2018, when this partnership started, this converse complementarity really allowed both initiatives to build on and leverage each other's work. And I'll have an example, a specific example of that a little bit later, but that really kind of helped us both work towards this shared goal of improving guideline development and implementation. So I'm going to go more into detail on adapting clinical guidelines for the digital age, since this is the initiative that I happen to lead while at CDC. And I'm going to start with the bluff, the bottom line up front. The problem we identified was long lag time and inconsistencies, as well as inaccuracies in translation, which can lead to an average of 17 years for scientific evidence to apply in patient care. The reason we identified is that we're essentially playing the telephone game with guidelines, right? So we have these multiple translations of guidelines that add complexity, opportunity for error, and variation across sites, and sometimes even providers within the same site. So the solution we came to was developing the tools and the guidelines together so that we can help evidence applied to patient care more easily, quickly, accurately, and consistently. The other thing we realized was that we really needed multiple perspectives. So just like several of you might be looking at this image here and you see a white chalice or goblet, maybe others are seeing two faces looking at each other, and others still maybe are looking at an upside down candle holder. We really wanted to think about all the different perspectives from across the continuum of guideline development and implementation, because each of those perspectives had a different angle that they thought about things through. And that would really ultimately help us identify root causes and collectively come up with holistic solutions. We wanted to work towards an ideal state. So like in a perfect world, what would we want to have? Well, we thought about maybe an ongoing plan, do, study, act cycle, this continuous virtuous cycle that starts with the plan as the clinical guidelines, the do as clinical decision support, the study as clinical quality measurement, and the act as the desired clinical or health actions that we would want to perpetuate through those recommendations. And by using this approach, it's really kind of that living approach, right? Living evidence and guidelines, a learning virtuous health, learning health system, if you will, that helps us continuously improve and continuously update as needed the guidelines so that we can continue to improve health outcomes for patients. So the first thing we needed to do was really understand what was happening in the current state. And you can see a picture of a portion of that in the top right. The challenge that we identified was that the current state process is very sequential and siloed, where you start with the guidelines expertise and those guideline panels that produce the written guidelines, narrative guidelines, often published in a journal, and then communicated out, disseminated so that others can hopefully take those up and use them. So there's that communication expertise. Then the informatics expertise comes in because someone translates those recommendations into clinical decision support tools, whether that's the electronic health record or EHR vendors, whether that's a third-party app developer, or possibly even the individual healthcare organizations. Those tools are necessary but not sufficient to ultimately apply the recommendations into patient care. So that's where that implementation perspective comes in order to incorporate the tools within the EHR and within clinical workflows to ultimately reach the patients. Once those recommendations are technically within the workflows, the clinical workflows, you'd want to be able to evaluate it to make sure that truly they have been taken up and that they're resulting in the outcomes that you expect. But what we found was that evaluation wasn't very consistent. And in fact, even clinical quality measures, which are often required by regulation, were treated more like regulatory checkboxes than quality improvement activities. So what you ended up with was inconsistent or non-existent feedback loops back to the guideline developer. So a broken loop, not that continuous loop that we had in our ideal state. So this actually presented an opportunity to redesign the process into something more parallel and iterative. So in our proposed future state, we would have all the relevant perspectives working together from the outset in an interdisciplinary and iterative engagement in guideline development, translation, and implementation. So effectively, you would be able to maybe produce kind of a package of these written and computable guidelines and their derivatives like clinical decision support, clinical quality measures, or other digital tools to help get those recommendations into patient care, again, more easily, quickly, accurately, and consistently. And then if we build in consistent and iterative feedback loops throughout the entire process, now we're closing that loop and we have that continuous improvement, that virtuous learning health system throughout the entire process. So in terms of the outputs of adapting clinical guidelines, one of those is a health informatics or a health IT standard called FHIR Clinical Guidelines. Most people call it CPG on FHIR for clinical practice guidelines on fast healthcare interoperability resources. FHIR is a kind of a broader health IT standard that's used globally across electronic health record systems to really help standardize how healthcare data is documented and exchanged. This particular standard establishes a way to represent the information in clinical guideline recommendations so that it could readily be translated into derivatives such as clinical decision support and ultimately incorporated into patient care. It goes through an international vetting process called balloting. So far, this standard has been balloted twice, with the last update published in November 2024. And this is the example I wanted to share in particular of one of the first examples of the sharing between the two initiatives with WHO's SMART guidelines. The SMART guidelines initiative has not only leveraged CPG on FHIR, but they have since also contributed and helped expand it. So it's become kind of a collective effort to create an international standard that everyone can use. And you can take a look at more details about it in the URL listed at the bottom there. Then we also had an integrated process and evaluation framework. The integrated process with integrated evaluation more or less is the same diagram that I showed in a couple slides ago, the proposed future state. This is it in more of a cyclical version with more detail. And now you can see that, again, the method of continuous improvement, that iteration throughout, and also the different layers of activities like guideline development activities, informatics activities, evaluation, and at the center, the users, whether those are clinicians, care team members, patients, caregivers. The key here, the human-centered design piece, which you're going to hear more about shortly, is having those users at the center and thinking about those as you develop and implement guidelines. So if you'd like to read more about the Adapting Clinical Guidelines for the Digital Age Initiative, there is a journal supplement that we published in the American Journal of Medical Quality. You can, again, use the QR code if you'd like to take a look now. And there's also the links that will be provided to you in the slides soon. Now, even with a redesigned guideline development and implementation process, we still have pain points remaining. So how do we find solutions? Well, this is where I'm going to turn it over to Mindy to tell you more about human-centered design, or HCD. Mindy?
Maria. So I'm going to cover more of the methods that we use for human-centered design, and then Shireen is going to follow after, where she's going to give you kind of the specific examples of how we applied this to the guidelines. And so the one thing to remember about human-centered design is that there's a lot of tools that you could use. And so I'll showcase you the tools that we used as part of our human-centered design process. So you can get kind of more of a taste of what we went through during this event. So my first, and as Maria had mentioned, we're going to have some interactive exercises. So what I would like you to do is take a look at this object on your screen, and we're going to do a divergent thinking exercise. What I'm going to do is give you a minute, and if you can think of all the different uses that you could use this object on the screen, also known as a paperclip, and come up with as many uses as you can. So I'm going to start the minute now. Okay, time. Great. So I see quite a few coming in the chat of different ideas that you had. So a chip bag holder, bracelet, carabiner, paper clip, sculptures, unlock a door. Can you guys estimate about how many you came up with or count up how many you had and put whatever number that is in the chat? So how many different ideas did you guys have? See, fishing line, a dress. Wow. So 15, 5. Good. So typically what they find is, anywhere for adults, get around 5 to 15 uses in that minute. But when they let, little kids on this exercise around 5 years of age, they find that they can get up to 200 uses for what we know as a paper clip. And obviously they get a lot more than a minute. So you guys kind of got gypped on getting unlimited time. But we find is as we get older, we get really good at knowing how to use things in the way that it's supposed to be used. So more of this convergent thinking, because our brains are recalling past events and experiences that tell us this is how you use that. So it takes away from us having, this really creative approach when we're trying to solve problems. And so one of the things, and Maria, if you can go to the next slide. So what we're trying to do with human-centered design is really kind of get ourselves into more of this creative space. And human-centered design, it really, that human piece in there, it's a way to look at really complicated problems and really understand the end user. And so building that empathy with whoever you're designing for. This method is iterative and agile, very similar to a lot of the quality improvement different types of methods. And what I find, with this method is it's really helping to understand your user's needs and behaviors. So it's kind of getting to a layer deeper to really help with understanding how to solve these more persistent problems. And we're really always looking at, are we solving the right problem as we're learning about our customers to really come up with really good solutions that are going to meet the user with what they need. So on the next slide. So I love this quote, and it kind of goes back to that exercise that you guys just did. And I love Maria's animation where the horse was just flying through. And so Henry Ford back in the day had said, if I asked people what they would have, wanted, they would have told me a faster horse. And so you can see that kind of convergent thinking of, what they really wanted was something faster, but they looked at, previous experiences and what they knew, and they said a faster horse. And so with human-centered design, we want to be able to kind of think differently about how we're approaching our problems, because we don't always know what we want when you try ask somebody what they want. So the next slide. So human-centered design has 3 different phases: inspiration, ideation, implementation. And that first phase is really, who are we solving for? What pain points do they have? And really defining and making sure that we understand what the problem is that we're trying to solve. And then ideation is really coming up with what kind of solutions could potentially be an answer to solve those pain points. And then the last piece is our implementation, where we're trying to figure out, with prototypes and bringing that customer or user into the mix and understanding, like, what do they like, what do they not like, and then finally testing to just make sure that we have the right solution that we're going to go forward with. And so I'm going to step through these 3 phases in detail, but before we do that, I want to show you just a quick video that showcases a human-centered design-ish process, so you can see it live in action with more of kind of an abstract idea. So Maria?
I'm JB Brown, the Nordstrom Innovation Lab Manager, and this is the lab. We work on 1-week experiments. Somebody will have an idea and we'll find a way to figure out how to prove if the idea is going to work. And this week, the Innovation Lab is going to be building an iPad app with customer feedback as we go through the week. We wanted to work in the store to make sure that we were getting customer feedback as we worked, so that we were never working on anything that wasn't valued by the customer and only doing things that are delivering value. So we'll be building a feature and testing it until we get to the point where we have something that's good enough that we can just leave the iPad app behind and have this new thing that customers can use. This is the world's first Flash build. It's a flash mob where a software team shows up and builds an application in a surprise location. This is the Nordstrom Innovation Lab, and we're at the flagship store in downtown Seattle. Right now the team is just setting up their equipment to get started. We're going to build an iPad app that helps customers pick the best pair of sunglasses for them. We really don't know what the features are yet. We're going to use customer feedback as we go along throughout the day and the rest of the week in order to build the best thing.
So the next thing we're going to do is a user story map. So we're going to sit here and together outline all the steps the customer would take, and actually even beforehand how they buy sunglasses, like what are the different things that they might do and how that process might change if we have this application. And we'll actually dig into what we have to build in order to support that process.
So now that we've done a card mapping, we're going to do a paper prototype, and this is something that we commonly do in the Innovation Lab. It's a great way to show what we'd like to do in a rough prototype that we can easily throw out, change, alter based on feedback from the customers. I'll continue building individual paper slides, and our user experience specialist, Tel, will bring the prototype to a customer and say, okay, I have this app and this is a paper version. I'd like you to kind of use it like you would normally use an app, and you can press things, interact with them, and then she'll change out the pages based on how the customer uses it. So it's a similar experience to the iPad, only an analog version.
So it's day 2, and we have our first working prototype of this app. And how it works is I take my first pair of sunglasses, put it on, take a picture, all right, and then I want to compare it to this other pair I've got right here. Put these on, take another picture, and I can just hold these up like this and see which one I like better.
While Tel and Kim have been talking to people and doing paper prototypes, we've been coding, building an iPad app. We take a stab at something, we look at the paper prototypes that Kim put together. We might take one at a time. Usually we come to the board and we grab the most important feature and we start implementing it. The really cool thing with this flash build is that we have actual real customers. Just today we delivered 4 or 5 different separate features, and I deliver it, swap the iPad with Tel. She'd go and talk to a customer, and 10 minutes later I had feedback from real customers about this thing that I delivered, and it changed how we did the next thing.
And it's been really, really great watching day to day what they've been doing, the team, to get all the feedback from the salespeople, the feedback the salespeople have gathered from the customers. And it's a really interesting process to kind of come in. On Tuesday, we had no idea what this would look like. There was an idea that somebody had to say, people take a lot of pictures of themselves with the sunglasses. It'd be cool if we could show them side by side to help them make the process better. And that was the idea, that was it. They came in, they had nothing built, and they've been building this literally on the spot throughout each day. And by now, we actually have an app, a functioning app that they can go through. It's very intuitive to help look at themselves and make the sunglass selection process easier, which is pretty cool to watch.
So yesterday, the sunglass buyer for Nordstrom came down to check out our progress, and she happened to put on polarized glasses and then held up the iPad in portrait view and was surprised that she couldn't see anything because it was black. And we figured out that the polarization of the iPad running up and down and the polarization of the glasses running vertical cancel each other out. You don't see anything. But if you turn the iPad to landscape, you see perfectly fine because of the polarization of the two items, and it's okay. So it was a pretty good find to be in the store, and she just happened to put on polarized glasses. And so today, first thing we're going to do is switch it to a landscape design and then lock in the aspect ratio of the iPad, so customers and salespeople just naturally pick it up and use it in landscape and not try and go to portrait.
Okay, so I'm going to show you what we've been working on the last 5 days. We've added quite a few features over the week. You take a picture, multiple pictures of the customer, and then you can pull them up. You tap the first one, you can see it larger, and then tap the second, and do a side-by-side comparison of each glass next to each other. We also added a feature where you can rename the picture, because we heard from salespeople, if a customer's trying on quite a lot of glasses, it's helpful to be able to know what order they were taken in and also rename if you want with the brand or some distinguishing feature about the glass. Another feature we added was the ability to zoom. You can zoom in and really get a good detailed look at the frames side by side. Also, to see one of the pictures larger if you want to just better view of one frame. You can flip the camera view as well. Face it forward so the salesperson can take a picture of it like this, or you can flip the camera like so. Take a picture of yourself facing forward. And then at the end of it all, we have a button called New Customer, which just erases all of the images and allows the salesperson to start with a new customer.
We're just trying to put the final touches on the app. Tel talked to a lot of users, and they said that when we went into the compare view, it was unclear where the pictures were coming from and which picture was which. So the animation here is trying to solve that problem, make it a little more clear what's going on. One of the challenges with software is when are you done, right? And I think the answer is really, it depends on how much time you have. At least the most important things got done. So this was time boxed to a week, and we did a week's worth of work, and it seems like what we have now is something that makes customers happy and addresses the main problems, and something that we can track, we have metrics on. So I think we're gonna call that a day.
The application has developed so far. Everything's finished, everything that we've asked for, and even the little roadblocks and glitches that we kind of stumbled across as we use the app during the week has been solved. I think that it's going to be really easy to be able to implement into our sale, and I think that we're going to find a lot of success with the application, whether it's via a selling tool for us or if it goes public into a downloadable format. Whatever happens, I think this was generally quite a success.
Imagine if we could do that with guidelines, or as you're building quality measures into the EHR. So, that video shows a very fast-paced kind of human-centered design process where you're really iterating and getting that customer feedback. So now I'm going to walk you through the 3 phases, and you'll see stuff that you saw in that video. I'll explain kind of how we incorporated some of those elements into what we did as we applied the human-centered design process to the guidelines. So this first piece was our inspiration phase that we did ahead of the workshop that we had in person. And this again was focusing on really understanding our customer. And so the next slide. So the way we did that is we started out with just really understanding the problem are we trying to solve? Who are the different users and stakeholders so that we could really narrow in the scope on where we wanted to focus, understanding what constraints that we had to make sure that we took into consideration. And then we came up with exploration questions. And these are really, where do we have assumptions or where do we think we know what's happening? We want to make sure that we get that really in-depth understanding. And then making sure that we understand what are we trying to get out of this, or what are those outcomes or success metrics. That helped us design this research plan. And a lot of the research that we did was using semi-structured interviews and then also observations. And that was to help us really get this in-depth empathy for our end users or different stakeholders throughout the process. And so that helped us put ourselves in their shoes to really understand where are the pain points and how are those experienced. We leveraged video conferencing to do this, where we had verbal consent up front to really understand the customer experiences. Now, if you can do this in person, it's much better because then you can also see the environment. So for instance, if you were trying to understand the patient and doctor experience of using the practice guidelines, it would be great to see what environment they're in and when things are happening to really understand a much broader picture. But for this activity, we were only able to do it virtually, and we did those in anywhere from 30 to 60 minutes, held different interviews and observations of what they do. And we took this information, and on the next slide, we created personas. And so you see at the top, we have the patient, clinician, guideline developer, implementer, and informaticist were the different roles or stakeholders and customers that we were looking at. And this persona really paints a picture of who we're trying to design for. So we first understand kind of what's their worldwide view, what are their hopes and goals, and then more of like, what are their pain points or frustrations? And we also are looking at what behaviors. So we want to understand more of kind of underlying what motivates them, to help us really with who we're designing for. So it really paints that picture so we can internalize who that person is or that role is. And on the next slide, this starts to get into what is that job that they're trying to do? Like, what are they trying to achieve with the part of the process that we're looking at? And so we create what we call a journey map. And we do that for each one of the roles again, really understanding the high level steps that they're going through. And then where are they hitting emotional highs versus where are they hitting emotional lows as they go through that process. And what this does is it really captures where their pain points are throughout the process. So once we have those pain points on the next slide, we start to prioritize them, and we use a matrix that we call a pick chart, where it's helping us to identify what are the priority pain points. And so we're looking at how hard or easy is it to make change around the particular pain point, and then what's going to be the impact. And then on the right side, you can see a list of the pain points that we prioritize for this effort. Shireen's going to go into each one of these pain points specifically after my presentation. So the next slide. So it's all of this information, and we brought that into the workshop so that we could really jump into more of this ideation phase. And on the next slide, what we start out with is really framing our design challenge. And so we took each pain point, and this is, we're constantly going back and looking at, is the pain point correct? Are we solving the right thing? And so we had multiple times that we iterated on the pain point, and we use what we call how might we statements that help to frame the problem in kind of creative language of putting us up to this challenge of how might we help a certain user solve this pain point so they can achieve what is that task they're trying to achieve. And so once we have that how might we statement, we created design criteria. And this isn't solutions, this is really more like attributes or requirements of the solution, to make sure that it's going to be something that's feasible and viable and also aligning to what the user's needs were. And the next slide. So we're going to get into another interactive exercise here. And so I want you all to pretend that you are food influencers. And so we have created a how might we statement that we're going to use for you guys to come up with some design criteria. And remember, the design criteria are really, they're not solutions, but they're attributes. So if you think of the Henry Ford horse example, they were wanting something faster. So that would be a design criteria. And so as a food influencer, so you are now food influencers, we found that this food influencer was having a lot of a pain around, she was getting a lot of people asking her to share her recommendations. And it was trying to keep track of all the different restaurants that they had been to had made it really challenging. So what they wanted was something to, how might we help our food influencer document their restaurant experience so they can easily share their recommendations with other foodies when asked. So what we want you to do and put your answers in the chat, what kind of design criteria as a food influencer or as, trying to solve this pain point, do you think that this solution should have? So if you can go ahead and put those in the chat, and I'll read a couple and then we'll jump to the next thing. Sensual. Yep. So I see interview. So including location, type of food, personal rating criteria, and they could be filters. So really want to make sure that we're having all those kind of key information in there. All right, we'll take one more. Origin, so knowing where it is, minimal clicks, gluten-free. Wow, we're getting a lot in here now. Okay, awesome. Great job. So I am going to have Maria switch us over to what we came up with when Maria was my food influencer that was helping me with the design criteria. So we also had easily searchable, and also, searchable by different factors, documentation. So that matched, I think, what we saw. The ability to pull in data, and ability to pull in data not just from different sources, but from also different influencers, and that this would be personalized. So this criteria it really helps us with, as we step into the design, to give us some guide rails as we're thinking about what we should create as a solution. So on the next slide, part of this ideating, and the first piece was really around doing a brainstorm. Now, brainstorming, there's lots of different ways that you can do this, because we want to get people back into that divergent brain, thought process. And so how we did this for our event is we had everybody do a silent brainstorm where they considered ideas that could be easiest to use, simplest to implement, and then most out of the box to just really, kind of get our creative juices flowing. And then the teams looked at those and they put their top 3 ideas. They prioritized the top 3 and they created these initial mock-ups or prototypes. And from those initial prototypes, they went into using a tool called co-design, where they were engaging with folks from other groups that were coming around and visiting their prototypes to give feedback on what their solutions that they had presented, to really let them know what they liked, what they wished could be different, or if they had questions, or if they had different suggestions. And so this was a way that we could incorporate this into what we were doing at the in-person event to really get that first initial pass of feedback. So we're going to go back to our food influencer. And what you see here is the first pass of a potential solution. And so you see this is, the food influencer is getting a notification based on their location saying, I see you just dined at French Laundry. Do you want to add a review for this location? And then subsequently, if they'd been at this location before, they were going to get, you reviewed this restaurant before, updated or no thanks. And so over on the right hand side, you see the different information that was provided for the food influencer to go ahead and put that feedback in there. Next slide. So we're going to have you help out with co-designing this. And so the first thing I want to ask you guys is, what do you like about this? So put your food influencer hat on, and if you had to use this as a food influencer, what do you like about the prototype that we just showed you? And put those ideas in the chat, and we'll just take a couple and then we'll jump to the next thing. Prompting. Okay, great. So that GPS, the prompting when you're at the location. Any others? Situational awareness, kind of knowing. So we transition to things that you would change. What would you like to see in here? Let's see, in caps, it already knew I was there prior. Do you want to drop a pin? Oh, nice. Suggest other French restaurants that I might also like to try. Share it with friends. Great. Okay, so I'm gonna, there's 2 other questions that we also ask as we're, looking at these different prototypes. And I see a last one, pictures, videos of food would be a nice addition. And make a note of what I ordered, like, did not like. And so then on the next slide, we are talking about I wonder, so questions or discussion points. So this would be anything that you would, be wondering about this particular prototype. So do you guys have any questions or discussion points that you'd like to add to this design? Turn into a subscription model. Yeah, interesting. And then we did have could we include pictures of food? How loud is the restaurant? The last question that we ask in our co-design is, any other comments or ideas? I think you guys have been great in the stuff that you've been putting in the chat. There's lots of ideas, about the subscription model. I, like the pictures and videos. There's so much stuff. Is it family friendly? Good. Yeah. I feel like restaurants are so loud now, or maybe I am the loud one. Laugh out loud. I feel like that too after COVID. I felt like, wow, everything's really loud. Cost. Great. So you guys are great co-designers. Thank you so much for participating. I'm going to have Maria now show you what we came up with when Maria took a look at these designs. And so, she liked the level of detail, the notification based on GPS, but for the changes, pulling in data from those different sources and from other, food influencers as well, wanting to see that. And then can we change the update review to add a new review? Because Maria had said that, she still wants to have that longitudinal data to see what she thought before and see how things had changed, because they definitely can change from time to time. And then I wonder, is there a way to get notified when new reviews come up from other food influencers? The notification of location was really interesting, because think of if you showed up at the restaurant, you haven't eaten yet, and then it notified you, and then the notification is supposed to be a prompt for you to do something, but you haven't had the meal yet to really weigh in. So making sure that notification happens at a time when it's the user is going to be ready to enter that information. And then we had this one in our chat too, the noise level, adding the noise level in there. And then Maria's feedback was also, can she see more of what the end user might experience during their perspective of interacting with whatever this solution is. So on the next slide, we're going to see the new version. And so you can see on the left, before, visiting the restaurant, that, it has more of the, what they would see if they were the person kind of searching out the restaurant. So, you can see your recent reviews, others that are based on, specific preferences. And then it has building in the Michelin awards, etc. And then on the right-hand side, it really changes, that GPS notification, and just offering just one thing. Do you want to write a review or not? And then adding the noise requirements to the details of what's provided there. So then after we did this co-designing in the session, we moved next to the implementation phase on the next slide. And this is what we were really getting into post the workshop. And so, we continue doing the prototyping and get into that in-depth testing. And so on the next slide, what that looked like for us is we did more co-designing. So we didn't quite have all the people that we wanted to test with in the actual event. So we did more in-depth testing on the refined prototypes from that initial co-design that we did within the session. And then we started developing a product once we felt comfortable with that we had enough information from our different end users and customers to really help us outline what a minimum viable product, or really it's the simplest version, as you saw in that video, just like an initial version that we can it have enough features to satisfy people who are early adopters, so that we could further refine and test. And this is how it's an agile methodology, because we're trying to minimize the waste or the amount that we spend on it. If I were to show you, a prototype that was fully built out and computerized, what we find is we don't get as much feedback on that, versus what you guys saw that we just showed you, more of a hand drawing, we tend to get a lot more feedback because people, our brains instinctively are like, well, they haven't put a ton of work in here yet. So we tend to give more feedback when it doesn't look as finalized and formalized. So we create that kind of minimum viable product at the end of our human-centered design process. And for us, on the next slide, we had to stop our human-centered design process there and pitch these solutions to teams that could take it further. Or else some of the teams also drafted manuscripts that they used for journal publication so that we could share what we learned through this human-centered design process. So I'm going to turn it over to Shireen on the next slide here, who's going to talk about how we use it specifically on guidelines.
Hello, everyone. Thank you, Maria and Mindy. I'm Shireen Shihab. I'm excited to walk you today through our recent work on using human-centered design, or HCD, to tackle persistent challenges in guideline development and implementation in real practice examples that Mindy shared in her slides. Next slide, please. So let me begin by giving you a quick overview of the workshop that took place back in April 2023. So this was a one-day in-person event designed to introduce and apply HCD methodology. As Mindy mentioned, typically these types of sessions unfold over a much longer time, but we wanted to compress the timeline while preserving impact. So during the workshop, we started with the provision of background on related initiatives such as the ACG project that Maria covered in her slides, so that we ensure everyone had some content or context. Then we introduced and actively applied the HCD method, where customers worked in multidisciplinary groups to really embody different perspectives. Next slide, please. As Mindy explained, in HCD, it's very critical to define who the key customers are during each phase of the process, whether it's understanding needs, ideating solutions, or testing prototypes. So in our workshop, we mapped out the primary customers involved in guideline development and implementation process across each HCD phase to give you a sense of scale. Just with a few numbers, during the inspiration phase, we engaged around 38 customers. In the define and ideate phase, second phase, approximately 35 customers were actively involved in framing challenges and generating ideas. And in the last phase of prototype and testing, about 44 customers continued refining the solutions and providing feedback. So this broad multidisciplinary engagement ensured that the solutions reflected are reflected a range of real-world needs and experiences. Next slide, please. So at the heart of the workshop, each of the multidisciplinary groups focused on a different challenge area. These groups started with exploring design questions, second, brainstorming possible solutions, then co-developed early-stage low-fidelity solution prototypes, similar to what also Mindy shared in her slides. So this collaborative model helped ensure diverse perspectives were reflected in the problem-solving process, where the main idea was to move beyond theoretical discussions and actually build something that could evolve in a real-world solution. Next slide, please. Excuse me. So the groups focused on solving key pain points that were originally identified during the pre-workshop interviews, which we prioritized based on common challenges experienced and emerged across the different customer types and across the field. So here is what we focused on. As you can see, the lack of clarity on how to apply recommendation, lack of feedback mechanisms, unclear language for different end users, incomplete information, particularly for diverse patient population, and finally, a lack of informatics expertise to clarify and implement guideline language. And each of these represents a systematic challenge and, of course, an opportunity to innovate. So accordingly, as you can see on the other side of the slide, we formed 5 core workshop groups, each focused on one of the prioritized pain points, and these are how and what, testing and feedback, unclear language, incomplete information, and informatics expertise groups. So now let's walk you through each team specific how might we statement, design question, and their set of user-informed design criteria to guide their solutioning. Next slide, please. So I'll start with the first group, and again, following the same different phases that Mindy shared in her slide in the HCD process, the how and what group explored how to better support physicians in understanding and adopting recommendations. Their design criteria emphasized using evidence to guide implementation methods involving both patients and clinicians in decision-making, and educating physicians in guideline methodologies so they feel more confident using them. The goal here is really to build bridges between the guideline authors and end users so that recommendations are not just clear, but also actionable in practice. As you can see in the figure, their prototype solution was to include an informaticist and or implementation scientist on guideline panels, bringing that practical expertise earlier in the process and not after the fact. Next slide, please. So this group testing and feedback focused on creating mechanisms for real-world feedback. Their question was, how might we help guideline development organization get patient-level data that can inform guideline updates so that it will improve their quality and relevance? Their design criteria included making the process collaborative and inclusive, create standard-based artifacts that are reusable and shareable across different systems, reduce bias as much as possible, keep user needs at the center, capture real-world data effectively, and enable rapid updates when new information becomes available. As to their prototype, also their prototype was a real data feedback loop, a mechanism that could enable continuous improvement of guideline based on how they perform in actual clinical settings. So this directly supports the goal of making guidelines more dynamic and relevant over time. Next slide, please. The unclear language group tackled the often overlooked challenge of vague or inconsistent guideline wording. Their question was about making language clearer for end users, whether they are informaticists, patients, or clinicians, and also making it computable. Their design criteria, as you can see, emphasize clearly defining the building blocks of a recommendation, testing the wording before rollout of to catch misinterpretations, getting an informaticist involved early in the development or review process, and including patients and clinicians when finalizing the wording. And as part of their prototype, it's to develop a structured template or standard operating procedure for wording recommendations, an SOP, in other words, reduce ambiguity before it can become a real barrier. Next slide, please. The incomplete information, especially about patient-specific factors, was the main focus of this group. Their question was, how can we help patients make confident, evidence-based decisions that reflect their unique needs? As you can see, design criteria included things like making tools interactive and two-way, notifying users when new evidence comes out, asking targeted questions to really understand patient preferences, factoring in social determinants of health and other psychosocial factors, following ethical AI standards that are available in the field, ensuring the quality of the data feeding into AI models. As to their prototype is, as you can see, an open source method using generative AI to collect and integrate patient-generated data, things like values, goals, and personal circumstances. Next slide, please. The final group worked on building stronger connections between guideline developers and informaticists. Their questions centered on fostering mutual understanding of when and how to apply computable guidelines. So their design criteria were to provide resources that show when and how to use computable guidelines, create a centralized space or a hub where everyone can find tools, resources, and align, of course, with the organizational priorities to drive the adoption and the change. So here the prototype is a marketplace. A marketplace is a centralized crowdsourced platform that offers resources, training, and networking opportunities to bridge this gap. And as you can see, it's designed to connect people with the right expertise to develop and implement computable guidelines that also meet organizational goals. Next slide, please. So our work did not end with the workshop. As Mindy mentioned, there is a post-workshop phase. And during the first 3 weeks, we continued in multidisciplinary teams, inviting everyone from the workshop to stay involved and even allowing new members to join. And this is where, if you remember, the number of participants in the last phase of our work was the highest, 44 customers. So we used open, transparent collaboration methods like shared folders and open meetings. Many of the groups continued working on their solutions beyond the initial 16-week plan. And this post-workshop phase allowed us to refine our ideas and prepare them for real-world use. Next slide, please. So post-workshop, we consolidated the initial prototypes that we shared into 5 ongoing solution teams, aligned with the same core pain points that that were previously shared. These solutions teams included patient-generated data and decision tools, real-world testing and feedback, SOPs for computable recommendations, the marketplace for informatics engagements, and AI integration recommendations. So these groups aim to not just design solutions, but to test, iterate, and move them toward real implementation. Next slide, please. So this is a summary of the products or pitches and outcomes that each team developed. And some have also, part of their output was manuscripts that were pitched to organizations like ARC, WHO, and the CDC. Some teams are already piloting solutions. Others have submitted manuscripts for publications, and some have been already accepted. Most of these articles will be published within the GIN journal. What's remarkable is that these are not just abstract ideas. These are tangible, testable products created through a user-centered iterative process following the HCD methodology, and they are already making their way into the field. So this ends my part. Thank you so much for your attention. Over to you, Maria. Thank you.
All right. Thank you, Shireen. So now we're going to go into how to model GIT North America's HCD approach. So for example, if you wanted to apply it for your own groups or organizations. And so we kind of think about this as a Venn diagram, this approach, and it's got 3 parts. Applying human-centered design to build empathy and iterate solutions, to extend a brief in-person event, in this case, a 1-day event, to a multi-week hybrid effort, and to share through webinars, conferences, like presentations and workshops. We really thought all 3 of these were important for our effort, because if you do 2 of the 3, you sort of leave out some of the benefit. So if you applied human-centered design in kind of an extended multi-week hybrid effort, you certainly could benefit the regional community in our case, or a working group or organization of the folks that actually participate. But then you're not sharing anything broadly to help others learn from your efforts. If you apply HCD maybe at like kind of a higher level or a theoretical level and share that with through webinars, conference presentations, workshops, etc., certainly those that attend the webinars and conferences might be able to benefit from learning about human-centered design at that higher level, but you're not really getting kind of an in-depth, hands-on approach to learning human-centered design. And then finally, if you just kind of leave out the human-centered design and you still have your multi-week hybrid effort and share any learnings from that, you don't really reap the benefits of the human-centered design method that you heard earlier in this presentation. So we really felt that this kind of tripartite approach was really our win-win-win for this effort. Some of the facilitators, well, you heard Shireen towards the end there talk about transparency, and one of the ways that we achieved that was through collaborative workspaces. We happen to use Miro and Google Drive, which we're offering up as examples, not necessarily as an endorsement. There's plenty of tools out there. These are just the ones that we happen to use. We had human-centered design facilitation, not just in that one-day workshop, but throughout the multi-week virtual effort afterwards. We brought together multidisciplinary and diverse perspectives so that we could think about things from different angles. And then, of course, that hybrid approach, being able to take that focused one-day event and extend on that so that those that participated could continue to apply what they learned and maybe learn more. And then we could also bring others that maybe couldn't attend the one-day workshop and be able to participate that way. But there were also some barriers. The first one probably isn't a surprise. There were competing priorities because everyone that participated, including the facilitators, had a day job. That was not this effort. And so we often had to work around those competing priorities to keep things moving forward. And similarly, we did this over the summer. So we had a lot of vacations or time off that had a little bit of interruption that we had to kind of work with and keep moving forward. And then when those folks came back, be able to catch them up so they can continue participating. We had a short time frame, relatively speaking, even though we kind of extended our one-day effort to a 16-week effort. It was still a relatively short time frame for the complex, persistent problem we were trying to solve in guideline development and implementation. So again, a barrier there with the time frame. And then last but not least, we had varying levels of HCD experience. So not everybody was an HCD expert. Not only were they not an expert, most of the participants had never used human-centered design in any kind of hands-on way. So that's where that facilitation really tried to help overcome this particular barrier. But now, what did the participants think? Those that participated alongside this entire effort? Well, multimodal participant feedback mechanisms to learn what they thought. Starting with the in-person workshop, we distributed a link for a post-workshop survey, and I'll get into more detail on that shortly. We also had some feedback in the post-workshop virtual effort in the form of an after-action review that we did at every bi-weekly meeting across solution teams. So this was a meeting that we had every other week where we brought all the different teams together and learned what they were doing, what issues they were having that we could help each other overcome. And at the end of that, we would ask 3 questions. What worked well? What could have worked better? And what can we improve or do differently? We would then take that input, incorporate it, and work the next couple of weeks, come back together in the next bi-weekly meeting, ask the same 3 questions at the end in order to, first of all, make sure that anything that we incorporated from the previous input was actually working as intended and did the improvement that we were hoping for. And if not, try to understand what could have worked better. And then identify anything else that we could do to continue to improve or things that we could do differently to facilitate the effort. So while we don't have specific slides on the way that we did the after action reviews for the post-workshop virtual effort, hopefully this helps you get an idea of how you can continuously improve by using this after action review method. But now going back to the workshop and the survey, we distributed a link, as I mentioned, to all 35 attendees, 12 of which responded. So that's a 34% response rate. We got no strongly disagree responses, which is great because the way that the questions were worded, and you can see those at the bottom of the chart, the more agreement there was, the more positive the feedback or the rating. And in fact, you can see here that we had a majority strongly disagree or strongly agree or agree on all the questions. And those are the blue and green bars that you can see there in the chart. So again, overall, pretty positive results with the workshop, despite the fact that it was short in time. And we wanted to dig a little deeper to learn more about the qualitative aspects of what these ratings represent. So what I'm going to show you in the next few slides are the questions that we asked alongside an AI summary of the responses we received. when you receive the slides, after the Q&A slide, you'll see a list of the same questions with the individual anonymous responses. So if you're interested in seeing what individual people said on the survey, you can take a look at that. So first question, what did you like most about this workshop? Well, participants appreciated the interactive small group activities and practical examples that helped apply human-centered design principles, along with the opportunity to collaborate, network, and think innovatively. The engaging format, frequent breakout sessions, and well-delivered presentations contributed to a productive and thought-provoking workshop. Well, that sounds wonderful. Then we asked, what did you like least about this workshop? Some participants felt the workshop was rushed with limited time to engage with other groups and review their work, suggesting more time for presentations and follow-up questions. There were also concerns about unclear pain points, insufficient didactic time, and the need for more upfront clarity regarding follow-up work and expectations. So these would be the things that we would work on improving next time we did a workshop like this again. What did you learn that you plan to apply after the workshop? Well, participants gained valuable insights into human-centered design and its potential to improve guideline development, particularly in digital formats and precision medicine. Some found the workshop helpful in understanding the different silos in guideline development, while others appreciated the opportunity to think creatively and incorporate feedback into the process. And would you be interested in testing any of the solutions developed during the workshop? And if yes, how? Participants did express interest in continuing to work with their groups on applying AI to guideline development, testing solutions, and refining frameworks. Several mentioned wanting to integrate solutions into software tools and exploring how different personas can be involved in early in the development process, though some were uncertain about their ability to commit. So this gives you a little bit of a taste of why we got the ratings we did on that workshop, a little bit about how it went and what the participants thought. And with that, I'm gonna close here with some key takeaways. So again, this GIN North America HCD effort built on previous global initiatives. HCD is a way to frame and solve persistent or complex problems, focusing on identifying the right problem and developing user-centered solutions. GIN North America used HCD to identify and solve pain points in guideline development and implementation, resulting in products that were pitched to other organizations or submitted for journal publication. Overall, participants expressed a positive experience, including, and maybe most importantly, thinking differently about their own work because of learning HCD. And last but not least, if you were interested in doing this yourself, GIN North America's three-part approach of apply HCD, extend an in-person event with virtual post-event collaboration, and share can be modeled by other groups to identify and solve persistent, complex problems. So we hope this was all useful to you. And with that, I'm going to pause for questions. And while you're thinking about your questions, I'll mention that you can connect with any or all of us at these LinkedIn profiles that you see here. So I'll turn it over for questions.
I do see a question.
Hello, Maria. We have one question in the chat, and that is there yet a gold standard or best practice model or approach for human-centered design in the guideline industry or other healthcare sector? And the second part of that is, and is AI assisting in any way yet with human-centered design?
So the closest would be that integrated process with integrated evaluation that I mentioned in the earlier part of the presentation, with some potential help from some of these products that were developed in this effort, and that health IT standard, because that standardization piece also helps kind of keeping things in a standard format. And able to be shareable across systems and keeping that consistency while still being able to learn from the content that's being shared. So that's probably the closest thing. And so the more that is used, the better. And then the more we can continuously work to improve. So the more guideline groups maybe that can adopt that approach, the better. Anything to add from Mindy or Shireen? The second part was AI too, right?
Yeah, I can answer the AI part. So with human-centered design or any improvement tools, there's a lot of kind of more general methods and tools out there with all a little bit of different flavors on them. And I think the thing that I think about is with any of human-centered design or lean, it's pulling in the right tools within those methodologies to match the problem that you're trying to solve. And like Maria mentioned, we have, kind of outlined what we've done. So I don't know if you would call it the gold standard is a first standard. And I'm sure, as you heard, we have improvements that we definitely could do to that. And then from the standpoint of AI assisting, another colleague of mine, there are some AI tools for that upfront research piece to really understand, like even some of the behavioral motivations behind like what you're hearing from the different interviews that you do as part of the research phase. I haven't used them myself. I'm trying to get a demo of the one that I saw somebody recommend. That's a colleague of mine to just see like how it's working. So I definitely think that is something that, will be out there in the future.
Okay, thank you. So another question is, do you have recommended resources for human-centered design tools?
I really like the IDEO group for their tools. I think maybe Luma Institute is another one as well. And then I've also been doing a lot of like understanding behavioral economics, because that also comes into play to understanding if you're trying to get somebody to do a specific behavior. It's called Irrational Labs. They have a lot of good resources. And again, like with these tools, it's all really figuring out what tools are going to work best for the problem you're trying to solve. So you might find, like we went through using personas and journey maps. There's lots of different tools you can use. It's really kind of following that outline of the different phases and stepping through that. That's kind of the key piece of human-centered design. So those are a few resources that I found really helpful and insightful around human-centered design.
Thank you, Mindy. Do you mind dropping those in the chat? Also, other questions? So I have a question, and this is from a guideline developer perspective. How do you determine the perspective or the expertise that you need to include in a human-centered design effort?
So one way is to really think about the entire process that you're looking to improve on, or the specific problems you're looking to solve at a high level. Because again, if you haven't talked to anyone yet, the goal is to really just kind of think about who does this particular problem potentially impact, and stakeholder groups, if you will. And then that helps you kind of identify your initial group that you would like to bring together, the expertise or the perspective that you want to dig deeper into. Sometimes talking to those folks might identify additional groups, but that's generally a good way to get your starting group of customer or stakeholder perspectives.
See, any other questions?
I have a question too, if that's okay, if I'm not putting in the chat. Maria, Mindy, and Shireen, this is really great presentation. A lot of information, very helpful. Thank you so much. I do want to know, how long do you recommend for a HCD effort? Again, you mentioned a 1-day workshop, post followed by 16 weeks. So, and in addition, meetings that you had. So how much time do you say, if you want to put into an effort like that, would take?
Mindy, you want to give that the first shot?
So I think it kind of depends on the size of what you're trying to do, but I would say the in-person session that we did, as you heard from the feedback, it was way too short and collapsed. I would say, probably more of a 2 to 3 day event in person. If we would have had more resources, it would have been great to pull people in ahead of time to experience some of those interviews and observations, because I think it's so helpful when you can see these different perspectives. It really helps you to get yourself into the shoes of those different, stakeholders or customers that you're trying to design for. So I would say, engaging more of the group in different parts of the process up front and afterwards too. Maria, I don't know if you want to add, or Shireen, from what you guys experienced.
Yeah, I mean, I think that part about like essentially the scope of the problem you're trying to solve. I mean, we talked about guideline development and implementation. That's a pretty big scope. So trying to identify even portions within that and then focus in on those, that that still took the 16-week effort that we had and probably could have used more. If you do it, for example, within your own organization and you focus in on a specific issue that is a persistent or complex problem that you have, you might be able to keep it shorter, but you approach it in much the same way. And Shireen, I don't know if there's anything you'd like to add to that.
Yeah, I agree with you, Maria. Again, it depends on the context of that problem. And again, based on that, like, you can assess how long it would take. But I definitely agree with Mindy, like for the training, but definitely some aspect might take more time, which is like, again, refining these solutions and trying to think how to best implement them in real practice. So which happened with us where some of the work has extended beyond the 16 weeks planned originally. But again, this depends on the context itself and resources, of course.
If you're making a sunglass app, you could do all of it in a week, it looks like. So it really depends on the problem you're trying to solve.
One other thing too, and we weren't able to do this, we didn't have any funding really for this effort, was, if we could have had, and we did engage with some guideline developers up front to really test out these solutions on their stuff. And we tried to, and we did engage our federal partners, but there's just, a lot going on there to, try and make it so that you can test stuff real time. So more, if you have, a guy, or you own a guideline, or, it's much better if you have control over that. You can get much further, where for our purposes, we were just trying this out and trying to see how far we could get. And we did, pitch it and had some really good, first passes at stuff, but to really get the full human-centered design process and to get that into implementation, there's other things that I think, could be done in a future event, especially if you have control and the funding to use the methodology all the way through.
Thank you.
Thank you. So Maria and Mindy, one last question, and that is, how did you determine which organizations to pitch your minimum viable products to, and what type of things did you do to share in each pitch?
So maybe I can start, and Mindy, you can wrap it up. But generally speaking, for any of this type of effort, you really think about, first of all, organizations that there are already relationships with. So organizations that the participants were already familiar with, that have a scope to potentially be able to take on whatever the product is, and hopefully either further develop it or pilot it or both, and then get it to a more final version that then can be used more broadly. So it really starts with who the participants know, and again, making sure that the scope of what you're pitching matches with that organization's scope, making sure that they're able to take it on afterwards and improve on it, or I should say further build on it and get it to its more final form. Mindy, anything to add?
I think that's, kind of really just like who are you talking with and seeing what they have and what resources potentially. Um,
Well, thank you. Thank you so much for taking the time to join us today. Um, uh, Maria, Mindy, Shireen, thank you so much. This is a great presentation, great work. I have had the privilege to participate in the workshop in 2023 and a few of the subsequent sessions, and it's a lot of rich information. I do encourage you all, if you would like to revise or review some of the, I'm sorry, not revise, but review some of this information, that you check out the webinar posting on the GIN platform on YouTube. We will be wrapping up for today. If there are no other questions, thank you again for joining us and enjoy the rest of your day.